The first year of General Nursing and Midwifery, GNM, focuses on introducing students to the foundational concepts of nursing, community health, and healthcare delivery. In the Community Health Nursing course for GNM students, you will learn about key areas covered in GNM first year, Community Nursing, Introduction to Community Health. 1. Definition and scope of community health nursing. 2. Differences between community health and hospital-based care. 3. Principles of primary healthcare. Healthcare systems. 1. Overview of the healthcare system in India, or relevant country. 2. Structure of health services, including rural and urban healthcare. 3. Roles of community health nurses in various settings. Health education and communication. 1. Techniques and importance of educating communities about health issues. 2. Methods of effective communication, including verbal and nonverbal skills. 3. The role of mass media in community health education. Maternal and child health. 1. Focus on antenatal, postnatal care, and immunization programs. 2. Common maternal and child health issues and prevention. Epidemiology and public health. 1. Basic concepts of epidemiology, including the study of disease patterns. 2. Public health measures for disease prevention and control. 3. Management of infectious and communicable diseases in communities. Environmental hygiene. 1. Importance of environmental sanitation in maintaining public health. 2. Water, waste, and food sanitation. 3. Role of nurses in promoting a hygienic environment. Nutrition and health. 1. Basic principles of nutrition and dietary requirements. 2. Common nutritional deficiencies and their prevention. 3. Importance of community-based nutrition programs. Family planning. 1. Overview of family planning methods. 2. Role of community health nurses in counseling and delivering family planning services.